Hi class, welcome to another session on rehabilitation engineering. So we have been discussing the second unit, which is the principles of rehabilitation. So before discussing the principles of assistive technology assessment, let us just quickly discuss the common misconceptions about assistive devices. Now, as a rehabilitation engineer, you should be aware that of certain key principles while dealing with people with disability. Now, often when a disabled person hears about rehabilitation or a certain device, they just get their hopes really high. They just think that, this miraculous rehabilitation engineer is the solution for all their problems, which is not true. And as an engineer, as a clinician, as a rehabilitation personnel, you should make this very, very clear in the first setting itself. You know, an assist device will cure all their problems, is what they think when they come to the clinic, which is not true. Well, assist device is just going to improve their functions, improve certain functions. It is not a cure. I mean, if a person has had a stroke, there's no assist device in the world that can cure a stroke, his or her stroke, and then make them back normal, make them normal. If a person has had a spinal cord injury, there's no miraculous device in the universe that can actually rejoin the spine and make them normal again. That is just not possible, and you have to make this very, very clear in literally as blunt manner as possible. Because, if you just try to be polite and if you just beat around the bush, then they might get another, they might misunderstand, right? So all people with disability need the same assistive device. That is not true. I mean, no two disability are the same. So how can everything be cured by the same assistive device, right? So that is not true. You have to assess the disability and prescribe a device accordingly. Then assistive technology is complicated and expensive. That is so not true. If you have a cane, like someone is having issues with walking, you just give them a cane to walk with, and that cane is neither complicated to use nor is it expensive. So it's not necessary. Like these people, when as a rehabilitation engineer, you suggest that you can have this assist device, it's going to help you, and they say like, oh no, that'll be very expensive, that'll be very very complicated. I don't think I'll be able to cope up, and that would be the psychology of the patient. So you should educate them on exactly, what are the therapeutic procedures available and how to use the device, and then ask them if they would be interested in participating in this therapy. So again, assistive technology prescriptions are always accurate and optimal. This is only making me laugh. I mean, when your diagnosis cannot be accurate and optimal, that your assistive technology prescription can never be accurate, right? If you can't accurately diagnose the disability, like if you say like, okay, so and so has had stroke, so he or she will have this, and this, ailment. So based on that, you can prescribe this assistive technology, which is just going to nullify the effect of all this ailment. That's not true. It's not going to happen. And then lastly, assistive device will always be used. That's again not true. I mean, if for example, if a person has frozen shoulder, then probably a little bit of stretching exercises, some physiotherapy session would cure their frozen shoulder. They probably wouldn't need an assistive device to actually make their shoulder work again. So it's not necessary that assistive device will always be used. They are widely used, but not always used, right? So these are certain misconceptions that should be cleared on the very first visit when the patient comes to see you as in a rehabilitation center. So you have to make this crystals clear before you proceed with the treatment protocol. Now, in the next section, I shall discuss the principles of assistive technology assessment. Till then, take care.